Hi, everyone. It's Dr. Azi here. Welcome to the More Than a Pretty Face podcast. Hi, guys. Welcome back to More Than a Pretty Face podcast. We are hanging out. We just finished seeing some patients in the office, and we have the afternoon with you guys today.
Yes.
How are you?
I'm good. How are you?
Good. Are you ready for the holidays?
Yes, of course.
Are you decorated already?
Maybe. What gave it away?
Well, you're a very festive, person. If anybody's gonna put stuff together in the office, it's usually you. That time period where you were gone, nothing got celebrated, nothing got decorated. You're just that type of person.
I remember the girls were like, "What'd you guys do for Halloween?" Oh, we just threw on wigs.
Well, actually, we didn't. We brought them to the office, but no one actually did anything.
Yes. So.
We're so busy with patients. It's getting harder and harder, I feel like, to do stuff like that, but we're getting back into it.
We are. Yeah.
So do you have a beauty and blemish this week?
Of course. My beauty would be that I am ready for the holidays. I have everything organized, everything ready to go, and everything wrapped, and I'm on top of it this year.
Wow, that's good.
I know.
Usually me, it's December 23rd.
Yeah, I'm not going to lie. I'm usually not the best at it.
And my husband's birthday is in December too, which makes it even more stressful. Really?
Yes.
Gosh, so much to do.
I know. But my blemish per se isn't necessarily my blemish, but I'm going to steal my friends because, that's what they're for, right? So my
share their blemish with you.
Yes. My girlfriend is by far the biggest skincare junkie I've probably ever met in my entire life. You see memes about people like this, and she's the real deal. Her entire bedroom shelves and her vanity is like you're walking into Ulta and you're going to try on everything. It's intense. But she's kind of like a hoarder too, right? Because she's got all of the skincare. There's no way that she uses it all. It's a lot. So she had some that she was going through trying to clean out her inventory, and it must have been a really expensive one because she's like, I didn't want to just throw it out, so I wanted to use it. So for the last couple of weeks she's been using this product that she's had for years, and she's now breaking out really, really bad. And she sent me a picture. It's not like acne. It looks like she's having a reaction. I'm like,
wait, is she using a lot of products?
Yes.
Or do you think this is from the expired or the one that was
honestly,
old? I don't know.
A combination, because she has no idea how old these products are. She's like, well, I've been collecting them for how many years now?
You collect art, or you collect handbags.
No, not her.
Or stamps. I don't know if anybody does that anymore,
that's not giving your age away.
But collecting skincare.
Girl, her skin looks so bad right now, so bad. I told her, you need to just put everything aside, stop using everything, and let me talk about you on the podcast. Because I want to know your advice. Of course, using too many actives can cause a reaction, but doesn't shelf life play a part?
Well, I think it's probably two-part here. People that use a lot of products have a risk of damaging their skin barrier because you may be doubling up on some of the ingredients like exfoliants, or using exfoliants with, things like retinol or potent antioxidants like vitamin C. And the combination can disrupt your skin barrier. And if you guys have heard me talk about the skin barrier before, you know that the key to healthy, glowing skin is a strong skin barrier. If that gets disrupted, then that puts you at greater risk of infections and, bacteria and yeast getting in, and just, eczema, just inflammation. So probably she had a disrupted skin barrier because of her collection of skincare,
her home store,
her Ulta store in her room. But and then on top of that, she probably may have been using expired skincare. Now, Typically, most products have a shelf life of 2 to 3 years. That's what guarantees the composition of the product, the fact that the preservatives keep things from growing, in the jar.
Mm-hmm.
Now, if it's refrigerated, it's probably going to be safer, but this still doesn't guarantee that you couldn't have some bacteria or some yeast or something growing in there.
So are you saying keeping products unopened, unused in the refrigerator would like extend its
extend it by 3 to 6 months, but it's still not going to extend it for like 5 years. I mean, we know there are people that keep skincare for like 10 years.
Yeah, opened
hoarders.
Yeah.
They do that. They just don't want to let go of that $650 Chanel, cream that doesn't do a lot for your skin to begin with. Anyway, that vanilla extract from Chanel.
We won't go there.
So you run the risk of things growing, in the jar, even if it's refrigerated. You also run the risk of it separating, because a lot of skincare actives are, put in together in emulsified in a certain vehicle, in a solution or a lotion. Mm-hmm. And then over time, these things can separate because their composition changes. And preservatives, are only doing their job for a certain amount of time, and that's usually 2 to 3 years.
Now, are there certain ingredients that would break down faster than others, or for the most part, it's about a 2-year, 3-year shelf life?
So antioxidants tend to be less stable. Also oils. Oils break down.
Those are your favorite.
Don't get me started on oils.
That's another podcast.
I love oils. The problem with oils, especially natural, organic oils, they actually break down quite quickly because natural, there's not a lot of chemicals, whatever that means, in them, preservatives that keeps them, fresh. So they can break down and their composition can change into something becoming more sensitizing. So what you thought you were putting on is no longer that ingredient or that product. It's changed, and now it's like this allergen that you're using. Yeah. So she probably did get some sort of allergic reaction.
Well, I told her to stop everything, only gentle products until she clears what she's got going on.
But I would say the products that are useful to keep in the fridge would be things like antioxidants, peptides, certain retinols. They do better when they're refrigerated. You can extend the life to a degree, but again, not like by 5 years or anything like that.
But I mean, realistically, if you're using the product as directed, the product shouldn't last 2 to 3 years anyways, right? I mean, most products, if maybe I'm just overthinking it, but like there's no way like my BB cream or my Lift and Renew would last 2 or 3 years in my house.
No. I mean, you should be using them.
Yes.
and just don't buy so many. That's the thing is people get in a habit. I tell my patients, listen, don't get distracted. You're going to see some influencer use a product and you're like, oh, I want this. Or you're going to walk into Sephora and they're going to have all these things for you to buy. I feel like we are just over consumers in this country. I mean, we really don't need a lot of us. That's why I brought in AziMD Skincare, because I was tired of trying to figure out what was in like a gazillion things that everybody was using. And it was literally the only way I could manage and control the things that were coming into my patient's skin, because they would all be coming in exactly like your friend, like all irritated, using the wrong products, this and that. And oils too. Oils love to grow yeast. And I know they love to do that on the skin too. And so I think that growth factors, peptides, antioxidants are good to keep in fridges, but really try to use comprehensive products and less of them.
Sounds good. How about you? What about you? You have a beauty and blemish? Sorry, mine took so long.
Well, I don't know. Did you see that patient a couple of days ago that came in? I thought she had a chemical burn.
Yeah, I was going to say the one that looked like she had a burn on her face.
Yeah, she was all distraught. It was like she looked like a tomato.
Yeah, it was pretty bad.
Yeah, it was pretty bad. I felt bad for her.
What happened?
So get this. I guess she was in the holiday spirit and
I don't like the way this is going.
So probably somebody on TikTok was doing a DIY skincare mask of using egg yolks, baking soda, powdered sugar, and what was the other ingredient? Flour and cinnamon or something like that. Well, the key being she put a ton of cinnamon. I mean, she showed me this recipe. I was like, girl, you are using cinnamon all wrong. You should be using cinnamon on your muffins and on your French toast, but not on your skin. So she had a horrific reaction. It's funny because
the cinnamon, right? Yeah, I would imagine that'd be painful. Well, she looked like really it was painful.
So what she had is called contact dermatitis. And what's interesting is you may not see it the same day. Although she did say she felt like, her skin was a little bit tingling and just, she just thought, oh, it's working. So people were like, you gotta feel the skincare. If it's not like burning, it must not be good and it must not be working.
Exactly.
So she felt a little something, but she actually didn't see the reaction until like the next night. And that's so typical. It's kind of like poison ivy or poison oak, which, by the way, guys, is all natural, poison ivy.
Yeah.
And so, but you don't see the reaction until 24 to 48 hours later because it is a delayed, it's called a delayed hypersensitivity reaction. And things like spices, lemon, which is very acidic and really can disrupt your skin barrier. Things like baking soda, which is too alkaline, a lot of people use. Vinegar is another one I've seen. And then be aware of eggs. They can contain salmonella or other bacteria that could potentially get inside your pores and cause severe, cystic acne that looks really terrible. So those are things, and spices. So this is one thing I want to stay away. Cinnamon in particular is the worst. Cinnamon is just one of those really bad ones. Or even things like eucalyptic oil, peppermint oil, rosemary, or these are essential oils that if you put it raw on the skin can really cause burns, severe burns. I mean, this woman, if we wouldn't have treated her as early as we treated her, she probably would have ended up with blisters on her skin.
She really did. I would have never guessed that was just contact dermatitis. It looked so painful.
Yeah, she was in tears. She was very uncomfortable. But luckily, I feel like we caught it on time. We got her treated, and I think she's going to be fine. I'm seeing her in a couple weeks.
Well, that's actually perfect because I wanted to segue into medical skin grade. What classifies it being medical skin grade?
Medical grade skincare.
Oh my God.
That's okay.
Medical grade coffee, skincare. You guys. What is that? That's what is that? I don't know.
That is a great question because people always ask, what is medical grade? What does that even mean? Yes. And it can mean different things to different people. It's kind of like asking me what clean beauty is exactly, If you ask a dermatologist, it'll probably be a different answer than, let's say an influencer or whatnot. But I would say medical grade means a few things. One is that the ingredients are probably more potent, meaning more clinical than, let's say, something that you buy, from a fluffy store that's, just a lot of oils and things, right? So these are ingredients or products that are designed to either treat a skin condition or change your skin for the better, hopefully. And there are also products that have medicated ingredients. Like a lot of our products may have, things like sulfur 10% or salicylic acid 2%. These are government regulated, what we call OTC products, and they have to go through pretty, strenuous FDA regulations and things to be able to put into products. And they have to be used for their purposes, used to treat acne, hyperpigmentation, or things like that. So they may have, stronger, more potent ingredients. And then lastly, medical grade a lot of times also says that there's been research and clinical trials or research studies on the product itself. Like, for example, Skin Tight or, Lift and Renew, we have published studies on these products that show, for example, Skin Tight, we have in vitro studies that show an increase in elastin and collagen by 200% at 2 weeks. So these are clinical studies that were done on the product. Whereas if you get something from Chanel or La Mer or, some of these other, say, foo-foo brands or whatever, fluffy, whatever you want to call them, brands that are not really designed to treat your skin or change your skin dramatically. So it's fine to use like their cleanser or their, moisturizer if you absolutely love it. But even things like sunscreen, if you look on the back of a sunscreen that's been FDA approved, it'll have drug facts, a box that's regulated by the FDA. That I would consider that medical grade because sunscreen is considered, a regulated ingredient.
I like that. Well, I still can't get over the fact that I couldn't say medical grade.
No, you were saying...
I was like medical skin grade.
Skin grade.
What?
I knew exactly what you were saying.
But you guys, don't forget, I'm going to pause here for you guys to rate, review, and subscribe right now. Make sure you guys are following us on social media. Send us some DMs with all your questions because we love hearing from you.
Happy holidays, friends. It's time to get your glow on, and we have the perfect gift sets for you or your loved one this season. The Glow Getter includes our top-selling glow serum, a circulation-boosting mini jade roller with a limited edition luxe cosmetic bag. The Holiday Detox gift set is designed to relieve the season's stress and purify your complexion with a full-size detox mask, custom applicator brush, and our limited edition luxe cosmetic bag. Both sets are available now at AziMDSkincare.com.
So I do get a lot of DMs regarding medical grade skincare. And one of the biggest questions is what's the difference between an actual prescription and what you're saying is medical grade skincare?
So that's a great question. So for example, let's talk about azelaic acid, which is an azelaic 10 serum. Azelaic acid is a wonderful ingredient. We use it to treat things like perioral dermatitis, rosacea, somebody who has sensitive skin but has hyperpigmentation or discoloration. Well, at percentages of 10%, it's okay to be over the counter and be bought from our website. But once it gets to be 15, 20%, then it becomes a prescription. Or things like retinols or Retin A, which is tretinoin, that is prescription. But if you want it, but retinol, which is a precursor to Retin A, can be over the counter. So that's really the difference is there are categories of these clinical ingredients, and sometimes it's the entire ingredient in itself, like retinols, or it's a certain percentage. So you can have this like at, 10%, but once you are manufacturing it at a higher percent, then it needs to be a prescription. And that's just for patient safety and people not getting in trouble, like you would with putting cinnamon on your face.
Oh my gosh. I still can't believe that. So it looks like one of the other questions that we have is similar to what you're saying. Prescriptions are usually a higher grade or a higher percentage, but would that make somebody more prone to having a reaction then over time?
They can be. So that's why, I tell people, look, my philosophy is just, you just need 3 steps, honestly. And that's why I think there's too much skincare out there. You need a cleanser, your treatment product, which a lot of ours is in serums, right? Which is best applied to damp skin. And then you need a moisturizer. So pick whatever you want to use as a gentle cleanser, whatever you want to use as a moisturizer. But really the investment piece is that serum, because that serum has a concentrated amount of actives that if you're choosing a clinical grade, you don't really need anything else. I mean, everything else is just fluff. Like, people are using like hyaluronic acid before their vitamin C. Well, vitamin C, if it's a serum, should have hyaluronic acid in it already. So you don't really need, hyaluronic acid on its own. So the idea is to use the products with very minimal, routines. So you don't need a lot of steps or a lot of products when you're using more potent, more specific medical grade products. Make your life simple and keep your wallet fatter.
Oh my gosh, I've never related more until I was a mom.
Yeah, and who has time for that? I mean, I just, you see these TikTokers and they're doing like these 15-step routines, and you're like, really?
Yeah.
I barely have time to put on my earrings before I leave the house. Yeah, I'm not even wearing them today. So it's really it's going to be stronger. It's going to be more potent. So you don't want to use a lot of other products or a lot of the product itself too, I guess.
What would be your favorite ingredient treating fine lines and wrinkles?
Yeah, I would say, nothing beats a retinol. We have so much data and science to prove that. But not only does it treat wrinkles and, fine lines, but it just makes the quality of the skin better. It boosts circulation. It preserves the collagen in our skin. In a recent study, actually, there's a recent study in the JAD that shows retinols also enhance or stimulate your own skin to form hyaluronic acid, which hasn't really been proven until recently. So it just does so much for your skin. Now, a lot of people say prescriptions are certainly the more potent, the more effective, but sometimes getting over-the-counter retinols and combining them with other ingredients can make them just as potent or pretty close to being the same effectiveness as a prescription. For example, Lift and Renew has bakuchiol in it, which has similar properties to retinol. So by combining the two, you're enhancing the effectiveness of the retinol. Plus, it makes it less irritating because of the other ingredients formulated in that product makes it just as effective but less irritating. Now, you can't really do that with prescriptions because the FDA is so strict on how tretinoin is formulated. And oh my goodness, if you want to come out with a new tretinoin, a new prescription retin-A, do you know how many millions and millions of dollars it takes to get a product like that approved? Whereas with medical grade, we don't have to have as much clinical trials and so we're able to combine ingredients more effectively and use ingredients that have a calming effect with ingredients like retinol. And the other thing I didn't mention that I think medical grade has is technology that makes that product more tolerable. Like the retinol in Lift and Renew is in a slow release technology, which means that it doesn't get released all at once. It slowly gets released so that by the time the retinol makes it into the dermis, which is where it needs to go to work its magic, that's when a lot of it gets released. So it doesn't cause as much of the dryness, the peeling, the irritation. Yet the clinical study we have that's published shows that it's very similar in efficacy to prescription tretinoin.
I like that.
That's a long answer to your question.
Well, it's funny because you referenced JAD, and I've never heard it called JAD. So for our listeners, why don't you explain
what that is? It's the Journal of American Academy of Dermatology. So the other thing is, products like Alpha Ret. Have you heard of Alpha Ret? I think it's by Skin Better Science. But, for example, that is a great product. And I don't want to just talk about AziMD Skincare. I want to be, unbiased, but I'm biased, but let's talk about other products that are medical grade. So like Alpha Ret combines an alpha hydroxy acid with retinol. What does that do? The alpha hydroxy acid is going to enhance the penetration and absorption of that retinol, making it more potent and more effective. So combining different ingredients with retinol in a medical grade product, there's really some science and research that goes into that thinking. We're not just like mixing, potions and potions and oils, together and, calling it, it's good for the skin.
Right.
So good for you.
I know one of the most popular questions I get asked on a regular basis is what moisturizer I recommend. And I don't think a lot of people realize that it depends on what your concerns are, what your other skincare regimen is. Like, I know for me, if a patient walks in and they're acne prone, I'm not going to recommend a heavier, thicker moisturizer.
Yeah, like
Restore.
Cicaplast. Cicaplast is a product by La Roche-Posay. It's a great product, but it is so heavy.
Mm-hmm.
It causes a lot of breakouts for people. But if you're not acne prone and you have dry skin, then Cicaplast Balm is really phenomenal, and it's designed to be a skin protectant. And I would consider that as a medical grade product. Okay. Products with ceramides in them as well would help with strengthening your skin barrier. But yeah, if you're acne prone, you probably don't want to use a heavy, cream, because a lot of times that does cause a lot of clogging.
Mm-hmm. Yeah, and prior to this episode, I probably would have explained medical grade skincare as something that you can only get in like a medical setting, not something like at, Vons or Target or something like that.
That's not true anymore. Now it's so much more readily available thanks to the internet and a lot of companies coming out with really outstanding products that they've dedicated a lot of research to. But one ingredient, niacinamide, I get a lot of questions about that. That is great for somebody who has some irritation or has oily skin, because niacinamide is a antioxidant, and it also helps reduce inflammation and calm the skin, and it helps brighten the skin and regulate oil production. Now, there's some brands that have niacinamide as just a niacinamide 10%.
Yes.
Out there. Recent research has shown the sweet spot for niacinamide is between 2 to 5%. Anything more than that can actually be more irritating.
Okay.
So like The Ordinary has that one product that's niacinamide 10%. Like we see a lot of people come in with breakouts or irritation from that. Mm-hmm. So, but newer research has shown you really want that to be less than 5%.
And you can find that in a lot.
A lot of our products,
yeah. Right?
EltaMD has niacinamide in their product. So it's really, there's no reason for it to be a standalone product. Our moisturizer, our anti-aging moisturizer, Restore, has niacinamide in it, but it also has things like resveratrol, ceramides, caffeine, green tea, polyphenols.
What are those good for?
So a lot of them are antioxidants that help firm the skin. They stimulate collagen. They help with boosting circulation and brightening the skin. Okay. So really want to see a lot of these great ingredients that have pretty good science and research behind them to be combined into one product.
What about for the under eyes? Something that would help?
Under eyes is really tricky. So a lot of people have reactions, and I hate to say this, but a lot of times eye creams that have clinical ingredients like retinols or niacinamide may help with fine lines and brightening your eyes, but it's not for everyone, because sometimes the eyelid skin is so thin and delicate, it gets irritated really easily. Mm-hmm. So if you have sensitive skin, honestly, the best eye cream for you is just plain Vaseline. Just plain Vaseline overnight. Slug it, because you will wake up, your lines will be better because your skin will be more hydrated. But somebody with sensitive skin, you give them Eye Glow PM to use, which has caffeine and retinol and all these amazing ingredients that are supposed to work wonders for your under eyes. But if you have sensitive skin and you use that, you might wake up with puffy eyes, redness, your lines might get worse. Yeah, so it really depends on your skin type. But a retinol-based eye cream is great, especially with niacinamide, because it brightens the skin. And then the niacinamide helps reduce the inflammation and irritation from potential retinol.
Another huge question is the vitamin C serums, right? Because everyone wants to know what vitamin C serum, what's that sweet spot on the percentage of vitamin C? Will it cause irritation? What skin types can tolerate it? So how would you go about explaining vitamin C and the ingredients?
Yeah, I think we need to dedicate a whole episode to vitamin C, because it's such a complex ingredient, honestly. There's a lot of different forms of vitamin C. Really, the ones that are the purest, most active form is L-ascorbic acid. There are lots of other forms of it, but research has shown it's just not as good. It may help with pigmentation, but it just doesn't stimulate collagen like L-ascorbic acid does. And some of the other benefits are just not seen with the other forms of L-ascorbic acid. So ideally between 8 to 15% is what I say, because anything more than 15%, first of all, it becomes so hard to formulate. It's so unstable. It just breaks down and turns into something else. And so really it oxidizes. And so you really want it to be between 8 to 15. If you have sensitive skin, then maybe go for an 8 or 10, 12 at the most. But I find 15% is a really good clinical percentage for pure L-ascorbic acid, which is found in Aluma C. And I think that is honestly one of the most stabilized formulas on the market, very similar to SkinCeuticals, vitamin C, ferulic acid. Actually, if you look at the ingredients in the formulations are almost the same. And then there is a new analog.
My favorite.
Yes, there's a new analog of vitamin C. It's called tetrahesyl ascorbate, THD. And that is, a research has shown that it penetrates deeper into the skin. It's more stable and it's less irritating.
Yes. It doesn't smell like hot dogs.
It doesn't smell like hot dogs. That's what's in Glow Serum. The Glow Serum does have a little bit of L-ascorbic acid, but when we've done studies on that formulation, and even though it turns color, so it starts out as a lighter color and then goes like onto like an orange brown color, even with that shift in color, when they tested that, it was still just as potent. It really doesn't lose its efficacy and potency, and that's because of the THD that's in that serum, that it maintains its effectiveness. So I'm really excited for this new generation of vitamin C analogs that are going to be better. I think more tolerated, because a lot of people get
very irritated
from vitamin C.
Yes. All right. The last on my list is, and you kind of touched on it when you said that most sunscreens, or almost all sunscreens, have that FDA, box and ingredient list on the back. What do you recommend we look for as a consumer when we're looking for sunscreens and the ingredients?
Yeah, I mean, personally, I like mineral-based, so zinc and titanium is really the most stable in terms of sunscreens, because the chemical sunscreens we know will break down much faster than the mineral-based. But also remember, a lot of people store like sunscreen in their cars that get hot in the summer, or they go to the beach and they have it out, laying around. And that can certainly enhance the decomposition of that sunscreen. And there are some reports that some of the chemical sunscreens might decompose and turn into a chemical that might potentially be carcinogenic. But I don't want to alarm people, because it's not that common. But the mineral sunscreens are better tolerated for people with sensitive skin than the chemical ones. So things like zinc or titanium would be what I would go for if you are choosing one.
What about tinted versus not tinted?
So the difference is really in iron oxide. So tinted SPFs have iron oxide in them, which help attenuate what are called blue rays, or HEV rays, and those can come through windows. You also get them from screens and light. And I'll never forget, I was a resident in dermatology, and my professor, who was well in his 60s, he's like, I wear sunscreen every day, because even these lights that we're sitting under during the day, we're not even outside, even those can break down your collagen. And I was like, oh, really? I was like 22. I was like, oh, well, I am definitely following your path, because, and now, 20, 30 years later, research has shown that it potentially can, and it definitely can make hyperpigmentation worse. So that's why I say winter, summer, indoor, outdoor, just put on a mineral-based SPF in your moisturizer, preferably one with a tint. I've stopped wearing foundation since starting to wear Hydrogen BB. I no longer feel like I need to wear it.
I know, I love it. Well, we both. Everyone's like, well, I don't know if I'm the right shade, if it would be my shade. I'm like, well,
It really rubs in.
We are not the same shade, and we both wear it.
We both wear it. Yeah, it really, I love that product. It was inspired by a Korean product that I could only get when one of my Korean girlfriends would go, and it was in a mousse.
I remember you telling me
and it's the way it rubs in and dries like that. So it's inspired by that Korean product. And if you do struggle with rosacea or hyperpigmentation, using a tinted SPF with iron oxide will probably benefit you because, again, those blue rays play a role.
Yes.
So,
what an informative podcast.
Oh, I feel like this one was a long one. I kept rambling. I feel like
you were very passionate about skincare, and it shows.
I feel like we need a whole episode on each one of those topics.
We could definitely do that.
Yeah. Well, thanks, guys, for tuning in. We so appreciate your support and listenership on this podcast. We would not be doing this if it wasn't for you. So thank you guys so much for tuning in every week. We love to hear from you. So don't forget to send us a DM on More Than a Pretty Face podcast on Instagram, and hit the subscribe button. Share this with a friend who might also find this valuable.
Until next time.
Bye, guys. Thanks.